I am super stoked that I get to chat with you today.
Likewise, I'm very excited.
Yeah, it's always good. I'm like, oh, I get Dr. O'Leary today. This is great. I'm like, we're starting Monday off with like a bang.
Absolutely. And
Like
tomorrow's
sometimes I got,
Veterans Day. So I love that.
and what's today?
I'm not sure about that.
Marine Corps birthday.
I didn't know that, Dutch. Okay.
Yes. Yeah.
Interesting.
Big
Now,
day, big day, big
who
day
did you
for us.
serve with?
Big day for us Marines, you know?
Absolutely. So I was with the 1st Marines as a general medical officer for
We
1 year.
were?
I was in Camp Pendleton. So I loved it. Had a great time.
Nice.
So it was a great experience, and I got a commendation from General. And the funny thing was, I was with the Navy, and I was at a naval hospital, and it was administratively heavy. And being an independent physician, I wasn't doing that well. So they said, "We're sending you to the Marines." I was like, "All right." I went to
All
loved
right.
Marine Corps, loved it, absolutely. So
Wait, so you got stationed at Camp Pendleton. What a
yes,
place.
it was beautiful, absolutely beautiful, loved it.
Well, they always put officers on the nice part.
Oh, it was awesome. I loved the whole thing. We had a great experience, and it was great. I love the Marines. It was the best thing I ever did in my life, was serving with the Marines.
That, you know what? A lot of physicians say it, a lot of docs, the medics say it. I think we were a pretty tight crew.
Absolutely.
You know, like, hey, let's get the job done. And everybody's
100%.
a lot of smoking and joking, but when it came down to like, we got to do what we got to do, it was, I tell people, I'm like, it's pretty serious. Like you know,
100%. And I
like,
love the vibe of the Marine officers where the enlisted guys eat first. The Marine officers are in great shape. They take it serious. They're ready to go into battle if they need to. They're not sitting around.
that's,
They weren't the guys Pete Hegseth was criticizing, who are very big, out of shape. That's not Marines.
when I saw the flag officers in that deal, you saw the Marines like, yeah, let's go, buddy.
Go,
Woo!
boy.
I was so excited. I made one of those mistakes that loudmouth guys like me make. And we were on a run. And in fact, goodness gracious, we were at, the PLC course, which is the platoon leaders course in Northern Virginia. And I was kind of just rubbing this officer just a little, like, come on, come on. Like, I just needed him to kind of just get a little more excited. So when we start running, I start doing a cadence about how officers can't run and
That's
about
fine.
how they're slow. And I mean, we were pretty fast. I mean, I played soccer in college, so I knew I could run. But I'm telling you, this joker beat my rear end. And we were done. He's like, how'd you like that, Rojas? And I was like, sir, I really didn't like that very much.
That's funny. That's
He wasn't going to take it. And I love that he fought back. I mean,
that's
it
fair.
wasn't, there was no animosity. It was
No, no,
just
it's fun.
like,
It's fun.
it was like in a good spirit of fun.
Absolutely.
Yeah. I think we were running just right at 6 minutes.
That's
And
amazing.
he was not having it. He was like, "Oh,
Right.
you want to sing these songs? Let's go. Like, let's
That's
roll."
awesome. That's the Marine
All
Corps
right.
spirit.
So, hey, so what made you decide to join the Navy?
What ended up happening was I ran out of money. So I was the guy who was working jobs all the time in the summers, paid for college. So I'm like the last generation of
Yep.
people paid to go to private college. I paid
Yep.
for my first year of medical school, ran out of money. I was like, I have absolutely no money. And I looked around and I was like, you know what? The Navy has bases in good places. They're usually by the water. The Army, they put you in the middle of nowhere. I was like, I'm going to go with the Navy. Great, really enjoyed it. And then, like I said, ended up with the Marines for my last year, which is great duty. Went out with a bang with them and really enjoyed it. Really loved
So,
it.
so what'd you do? 6 years?
No, I ended up doing 4 years. So I ended
4.
up doing
Okay.
1 year of training. I did OBGYN internship at Portsmouth Naval Hospital. And then I owed them 3 years. So then I was 3 years as a general medical officer, 2 years up at Great Lakes, where all the recruits go. It's freezing up there. So they said, everybody from the South and the Southwest, they said, let's freeze them. And the people from the North, they send to San Diego. That's what
Oh,
they,
I love.
so
I love. So, how did you? Gosh, you were in Great Lakes. You were at Portsmouth.
Portsmouth.
You know,
And then Camp
these are
Pendleton.
all. I mean, I love Portsmouth. I've been there. Great Lakes. That's tough. How'd you like dealing with recruits?
I love dealing with the recruits. They were It's fun. They're young guys. Most of them were scared out of their mind. And I was working in ER there, and we thought what we really needed, above all, was a grandmother with some chocolate chip cookies. Because half the ER visits were because these guys were homesick. You know,
Homesick. Yeah.
I mean, it's hard. It's hard for these guys. They're away from home the first time. It's stressful. And this was going back. So I was there in 86 to 88. So, the recruits were treated a little bit harsher now than they probably do now back then. And so it was tough on the guys. They were stressed out. But, the thing is in the Navy for physicians, I did an OBGYN internship. You really don't have a lot of general medical skills, but the next year you're in an ER flying on your own. They're like, you have to figure it out. That's how it works in the Navy. But that was really good training later because most docs in OB are just focused on OB. And I'm like, okay, well, that's one part of it, but I can focus on if someone has a diabetic emergency or something else. I'm used to thinking like that. So the other thing it taught me, which was really helpful in my internship, we had a lieutenant commander who was nasty and he was in charge of radiology. So if you ordered a CAT scan, you had to go down and talk to him. Now he outranked you and he didn't like you. And he'd say, why are you ordering this? What do you think this is going to show you? And how's it going to change your management? And if you couldn't give him a great answer, you got your ass chewed out and you're out of there. That always stuck with me. So I don't just order a CAT scan. A lot of docs order a CAT scan, like no big deal. I'm like, okay, that guy's his voice is still in my head. I'm like, okay, why am I ordering this? What's it going to do for me? Do I really need it? So I always think back because we didn't have a lot of options there. It was limited resources. So they taught you to use resources wisely. And that's different now than what the young guys coming up are used to. You go in the ER, everybody's getting a CAT scan. Nobody gets examined. They don't take a history because they don't have time. And then it's easier to just get a CAT scan. Trauma comes in, a CAT scan you head to toe. Go talk to that thing. I used to do when post-ops would come in my office, they'd have a problem. We had a long hallway. And I would sit on a chair where they couldn't see me, and I would watch the patient walk. And if they walked down that long hallway with no problem, I was like, okay, that's a very simple test. They probably don't have a major problem. We're probably going to be okay. If on the other hand, they really were struggling, I'm like, okay, there's something going on here. Now that's a simple test, but it gives you a lot of information. And that's the kind of stuff that I learned from the Navy. You have to really use your mind, take in all the information you can. This has predated the computers. So we actually looked at patients in the eye. We talked
You actually had to touch them and talk to them?
no one
Yeah,
exactly
it wasn't clickety, click, click, click.
No. And when
I gotta tell you, this whole conversation caught me off guard, and I'm so happy about it because it's like now we're having a conversation about veterans. We're having a
yes,
conversation about your service,
yes.
which I did not know anything about, and so I'm glad you brought up Happy Veterans Day. Happy Veterans Day to you. Thank you
Thank
for
you
your
so much.
service.
Thank
I love
you.
this,
Thank
and you
you.
got to serve with my boys.
Oh, absolutely the best,
Yeah.
And I was lucky because I wasn't in combat. And when I was getting out, I was going to Mayo Clinic for my residency. I was all excited. All the guys were like, Doc, I think we're going to go down to Panama. Why don't you come down with us, man? We'd
Once
love
you come
to have
down,
you.
oh, you would have liked Panama.
So
was-
it's interesting.
Oh, Panama was, let me tell you, it's nothing but like everybody thought. I had this whole idea because Imelda Marcos had all these shoes, and
Yes.
I think I was young, and so I didn't know anything. And I thought it was like this lush paradise. We get down there, and it's nothing but jungle,
Really?
field jungle. Like you thought you'd get dry, and you were wet the next 10 minutes. You thought you put on a dry set of boots, and then you put on another pair of boots. Your feet rotted out. Like that was an experience that I don't think most people would ever want.
No, that's tough.
That's real tough. Gosh. Now I'm
That-
thinking about Camp Pendleton. What a great place.
It's
My buddy Angry Scotty and I were just talking about the other day. He was stationed in Korea. We were both at Camp Pendleton together when we started. Marines, when you do boot camp, I went to Hollywood boot camp, Christmas Day of 95, and you go up north and you go to Camp Pendleton. That's where you learn to shoot. That's where you learn to put some rounds down range. And so, we talked about that yesterday. Okay. So tell me, how did you get involved in social media? Because you are really good at it.
Thank you. So what happened was I retired in March of 23.
March of 23. Okay. Got it.
So retired. I was like, okay, what am I going to do? And I don't play golf. I don't fish. But I got to do something. So I was like, I started getting online. I was like, I really want to learn about health policy. I almost almost made a crucial mistake and said, well, maybe I should go online and get like a master's in public health or something stupid. Then I realized, no, I started getting on X and I started following people like you, lots of great people. And then I started going down rabbit holes. And I had this general sense that healthcare in America was screwed up, but just a general sense, because like most docs, I was so busy working 24/7, I didn't have time to do this. So then I really enjoyed going into it. And I was like, okay, this is awful. I was like, I need a mission for two things. I really want to do in my mission is to support the docs who are out there and the young docs coming up because they don't have the mentors that were in private practice that I had because everybody now is employed. So I want to say you don't have to accept that. You don't have to be treated like that. And the second thing I want to do is really advocate for the patients because when the physicians suffer, patients suffer. We're in it together. And that's the biggest lie in healthcare is that the physicians are the problem. And this started way back in the 70s. You had Ted Kennedy, 1973, HMO Act. We're going to promise you one payment. We'll take care of everything. That was the devil whispering in our ear because now patients have this thing in their mind. I have this card. I have to use my insurance no matter what. That gets me the best deal, which you and
Yeah.
I know is a joke. The insurance
Yeah.
companies are worried about making the most amount of profit. They don't care if they're helping us. So that's why I kind of got onto it, found great people like you. I was so excited the day you followed me back. I was like, yes, it's a win. It's follow me back.
I was equally excited. Don't worry. I'm always happy to find people who are saying things like what you talk about. You're like, here's how we do it. Here's
Yeah,
what doctors do. Here's how we can help you as patients. One of the interesting things I keep finding amongst many is what do you learn? Like I have docs all the time that say, I'm too scared to be on social media. And I go, listen, a ton of physicians got on social media and started learning. You don't have to get on social media to preach. You could just learn. So what
absolutely.
are some things that you've learned on social media that you're like, okay, I admit I did not probably know these things while I was a practicing physician, actually in medicine. But now that I'm retired, it's a little different.
Sure. I would say first thing I learned was about PBMs. I had a rough
Okay.
idea what they were, but I didn't know because they're really good at saying we're the good guys, big pharma's the bad guy. We're getting these rebates. I had no idea about how not only are they not adding any value at all, they're extracting huge amounts of money, and they are the ones that determine what drugs we get and at what price. And they're also taking out their competition. And it's insane. I was just watching that. There was a great hearing, Senate hearing on shoppability of health services. So it started out, you had, I would say, three great people on there in the beginning. Okay. So you had Mark Cuban, who's done great, great work, understands, smart guy. You had Keith Smith, legend, for free market. And then you had this gentleman, doctor, from CalPERS, and he's medical director. And he's
From
been
CalPERS.
correct. So he's a medical director and he's talking about reference based pricing, which is great. Love that idea. But then when it comes down to the pharmacy benefit stuff, it turns out Mark Cuban's Cost Plus Drugs tried to get on their network. Now, he didn't say, give us the exclusive, just put us on your network. If we're cheaper, use us. If we're not, don't. They wouldn't do it.
No.
And then they wouldn't get rid of the PBMs. Now, they're self funded. They don't need the three big PBMs. There's no reason they should be using them. And he was saying, well, there's things that they do that maybe down the line we'll figure out. I'm like, okay, you don't need them. You and I know enough pharmacists. We could get a great formulary tomorrow. We don't need them for that. We don't need them to negotiate drugs prices because their idea of negotiating drugs is what makes me the most money. So that was a whole big thing. I had no idea. So I started going down that. I really didn't understand the level of control of Medicare Advantage with the big insurance companies and how they
Mm.
game the system. No idea about that. I had no idea that when you get a denial from United Healthcare or these other insurance companies, it occurs in 1.5 seconds based on an algorithm. There isn't somebody reading the record. So all those things, I didn't realize how deep and how bad this system is. But on the other hand, again, I learned this from you, and I've talked about it ad nauseum. I didn't realize there was great options out there. And you're the one who kind of got me onto radiologyassist.com. And you
For sure.
preach
Yep.
about this a million times. I use it.
I've used it a lot. And When we had our 2 direct contracting companies, I put all of our patients on it. Like, so the guy that runs it, Ali Punalawa, the deal we made was I could use his network. And then what I would do, because I knew all the radiologists, is I told him he had like maybe 150, 200 locations. I said, every time we sign a new contract, I'll make sure they talk to you. I mean, his business exploded. We had a very good mutual relationship. I mean, we always have. He's a great guy.
So those are the biggest things
Yeah.
I learned, you know, kind
Yeah.
of upfront. And then now each day I'm learning a ton of things. Like one of the things I learned on this Shopify, I'll just call it Shopify. That's like the official name of it. But one of the things I learned from Rick Scott was all it takes for an agent to sign you up on the ACA exchange is your name, your address, your date of birth. That's it.
That's insane.
That's it. And then once they sign you up, I'm the agent, I get a commission, and then the money flows to the big insurance companies. And you know, you probably saw that study that said 40% of the fully subsidized people on ACA have had zero claims in 2024.
That's because half of them don't even know they're on it.
Hey,
It's true.
well, I could be on it. We don't know.
We would have you would have no idea.
No idea. No idea.
None.
None. So
Yeah.
I was shocked by that. So every day, I think that actually you're 100% right. They all need to be on social media, even if you're just taking in things and learning every day.
I talked to one of the product managers, and one of the things I heard was, "Oh, if you have MD and DO behind your name, we're going to make sure you're an expert. So what we're going to do in the first 3 months is we're going to amplify your voice, and if you get the enough engagement back, right, then we'll continue. And if you're not good, then we'll get rid of you, right? We won't amplify you. You're obviously somebody that was amplified." And so what I try to encourage the doctors with is like, "Hey, get on there, because you are not like me. I'm an accountant. I had to work. Like I had to over years and years and years, and people trusted you and followed you, and then they liked your stuff." Well, physicians kind of have a unique advantage. You also have less time. So I'm like, see, this works for you. You have less time. So you just jam it forward. What are some of the things you say to, because I know you've done these talks, to physicians who are a little leery, like, well, I kind of don't want to do it. What do you say to them? Like, hey man, come on.
There's a couple of things I say to them. I say that our profession is sinking like a rock. We have to
Yeah.
save it. We're the only ones who can save it. And the way you save it is, in my mind, and this is powerful, you get on X, you get on LinkedIn, you get on wherever. You have access now, unfettered access to the public, unfiltered access, which is wonderful, and put out a great, respectful message. And patients love it. I get so many patients out there say, thank you so much. So that's the first thing. And have fun with it. You know, do that. You'll learn a lot from other colleagues. People put funny stuff on there. You know, you have to have some fun in there. So I just say, you know, there's no reason not to do it. You can do it in 20 minutes. And we all have downtime. We're all like, OB, you're always waiting for somebody to deliver. You're at the hospital. You're waiting for the OR to start. You got plenty of downtime with the hospital. Do that. Jump on there. You know, that's first thing that I tell them to do that. And we have to save ourselves. There's no one else coming for us. And the other thing I really want to stress to all the docs out there, young docs, old docs, is we need representation. You've said this a million times. Our specialty societies don't represent us. The AMA does not represent us. We need representation because that's just the way DC works.
I mean, that's just the way it works. Yeah, you're right.
Table, man. We have to pay up. And, you know, I know you're on the board of Physician Led Healthcare for America. To me, that's the most logical organization for people to support and have them lobby because they lobby for the right thing. And the docs in that organization are the rock stars of medicine.
The nice thing about that organization is it's not so organized. Now, some
Right.
docs get upset about it. They go, I didn't see something about my specialty. And I go, listen, there's 2 full-time employees. This is not, they don't take your entry money and then get on a jet. There's no corporate office building. All the employees are remote. Anybody that does help, like me or others, it's all free. We're not getting, they don't pay us. It's all because we love the organization. We want to help people. So yeah, I do think PHA has a real chance to capture that voice, which you articulated. Um, do you think we, like, other than buying it back through lobbying, what is social media kind of the answer? Like, I love all your videos recently. You
Thank
started the videos, and by the way, they're just getting better and better and better and better.
thank you.
And so I'm like, okay, we went from like looking down, now we're looking up. I love the videos. Are they having the impact that your text is having? Do you notice a difference? Is it good, bad, or indifferent?
Huge difference.
Huge.
Huge difference. For some reason, if you say the same thing on text versus a video, there's a group of people who really will listen to the video and they respond to it. You can
Yeah.
put it the same thing in text, doesn't really get. And it's just different people, different ways. So it's huge impact for me. And I can tell my reach has taken off with that. And it's something I wanted to do for a while. And it's just a matter of getting the right setup because I want to do it the correct way. And so that's been a lot of fun as well. But I think the other thing with social media, back to your great question, is that I think the way for docs to win is to enlist two key groups. We have to enlist patients because the only thing that makes politicians toe the line and do the right thing is if they're afraid they're going to get voted out of office. That's what wakes them up in the middle of the night.
Right?
Sudden the patients get pissed off and they're like a transparency bill, like Marshall Hickenlooper transparency and healthcare pricing bill. How do you as a politician come out and say, I don't want anybody seeing the prices? That's a hard thing to get, in front of and try to block. So I think the more we get the patients, and the second one is the employers. I don't know why self-insure, and you're better at this, why do self-insured employers use BUCAs? Why don't they use transparent, independent TPAs and PBMs and say, not only do I want to see my claims data, I want you to come in here on a quarterly basis, review with me, and tell me why it's not going down more. What could we do to make the plans better?
That's a discussion for another day. But
Okay.
yes, I think you're 100% on the right path because there's a divergence there. There's kind of like 3 or 4 different criteria. But all in all, if I was new and I was learning about insurance, I would say to every employer in the United States, stop using the BUCAs.
Absolutely.
Now, there are a few exclusions. I mean, but like that's for certain people. It's not for everyone. It's the same thing with PBMs. Like, hey, why are you using Optum as your pharmacy benefit manager?
No sense in that.
Right? Well, I mean, look, here's where I get confused, and I'm going to have a couple of employee benefits guys that I like on next week. I get confused because the kickbacks, as Dr. Mary likes to say, the I call them rebates. She's like, they're kickbacks, such. I'm like, okay. What happens is the rebates go back to the employer, but the employer's the fiduciary. And so, but the premium, the individuals paying the contributions aren't getting that cash back. It's getting kicked back to the company, and the company's reducing their risk and their exposure. And I don't understand how that works. Like, if you and I are all together in a plan and it's self funded, and we're all co owners because you literally are a co owner. I mean, you have the liability if something happens and a claim happens, you pay it, right? And so it confuses me that then you can take those rebates, put them back in, and the CEO of the company just puts it right back in his pocket. I do think it's unfair that I do think it's unfair that employers are even tasked with healthcare in the country.
You agree with that. It's interesting because in one of the FTC reports, they talked about that. And there's a situation which you talked about. So if you had a high coinsurance and, you're going to the counter and you're buying a medication, you have to pay that coinsurance off the list price. Depending on what your coinsurance, if you have like a 50% coinsurance, it's $100, you're paying $50.
50
Now, if
bucks.
they get a rebate of $70, all of a sudden the employer only paid $30. You paid 50. So now you're taking your sickest patients and your oldest patients and they're subsidizing the plan, which if you look at ERISA and the spirit of it, that doesn't really go along with that. So that's what I would say to employers, really think about that. And I think where they get sucked into it is the PBMs whisper in the ear and say, we're going to give you these rebates. And, the other part of that
Yes.
rebate is you have fees. So you could say, we're going to pass through the rebates, but I'm very suspicious when you see 2 out of the 3 big PBMs have their group purchasing organization internationally. One's in Dublin, one's in Switzerland. So, why do they need to do that? Why do they need GPOs to negotiate these prices? You and I could negotiate 'em. I don't need them.
Yeah.
You know,
So sneaky.
it's
So
stinky.
now, did you know all this stuff when you were a practicing physician, or is this stuff you've
No.
just kind of picked up along the way?
Just picked up along the way. So what I ended up doing was, like, I read there's 3 FTC reports, interim reports on PBMs. So I read through them probably 3 times. I read through the House Oversight Committee report. So there's a lot of good information in there in those reports. They give you a lot of background
Lot.
and a lot of good, and it's great to use that because, I'm on X the other day and someone's like, your idea, this is a doc telling me, your ideas basically are terrible because you're going to harm people. What if they have $100 drug prescription? I said, okay, well, here's the deal. I said, maybe that $100 drug prescription costs $8 on Cost Plus. First of all, just check it. You need to know. Just you can't trust them. And the other thing with the insurance companies, when you have these large PBMs, there's no guarantee they're going to cover any medication that you're on. There's no guarantee that the medications on the formula, usually those are brand names and they substitute out a generic. They kick the generic off. So they're not really helping you. Everybody's got this mindset. Now, one of the craziest things I think going on right now is Donald Trump put up this tweet about, which I love this, but he's like, why are we giving subsidies to these big bad insurance companies? Give it to the patients. So everybody on the left, including a lot of docs, are like, this is terrible. He wants to get rid of all insurance. All these people people go into these crazy things. I'm like, okay, wait a minute. Why do you think shoveling money into the bukas is doing anything useful? It's like a furnace. You literally put money in a furnace, and you've got here's the patient in the middle, you have the hospital, you've got the bukas. So the hospitals are incentivized to raise their prices to make more money. The bukas are incentivized to raise it because of the medical loss ratio, and they're incentivized because now most of their business is no longer insurance, it's healthcare delivery. Like United Health, the 2,699 subsidiaries aren't insurance. So they're like, what do we care? We're gonna make it up on the PBM, the physician services, the ASC. So now the game's changed. So we need to change the game and get out of it. And we need what
Yes.
we've said, catastrophic insurance for the big bad things, and then let patients shop for the rest of the care
Yes.
and price transparency, all the things you've been saying forever, which are 100% true. I was on the Indiana website, which shows all the claims in Indiana by zip code. And in one zip code, you could pay $1,200 for a colonoscopy or $12,000.
Isn't that nuts?
It's not some self-insured guy's paying 12 grand sitting there and like, why is our plan going up next year? Because you're an idiot.
Yeah, I think one of the hardest things, and you've said this and addressed it, and so has Mark Cuban, is to have a real honest talk with the employers because they do not. Like, I always say they don't care. That's me being probably a little too vitriolic. I think they're probably acting rationally in an irrational system, but it is something that and they're the largest advocates we could ever have. There's 107 million people on self-funded plans. Why aren't 107 self-funded people leading the marketplace?
Absolutely.
Why? Now, we did a little bit of work. We talked to Meta, we talked to Amazon. This has all been 4 or 5 years ago. Like, those guys pay for their benefits within 1 or 2 days. But most companies, it's 35, 40, 60 days to pay for their annual benefits expenses, right? And so you've got large companies, we'll pick one, Comcast, or pick a large labor union. In Indiana, you've got several that I've worked with in the past, and they've got 15, 18. There's one in Fort Wayne, Indiana that I worked with, 37,000 union members. It takes them almost 60 days of work to pay for their benefits. And so you'd think that those individuals and those groups would be highly incentivized to fix stuff. And yet here we are a decade later, nothing. So I don't really, I'm saying all that to say, sometimes I don't know what the impetus is. Like, how do we really get them to react? The thing that I was trying to get to is, I love what you said about getting people. I think we've got to speak to the American people. And we have to help them understand what's going on. Like you said, I learned these things after I stopped practicing. I learned them after I built surgery centers, after I was the chief operating officer of a large practice, after I I was 15 years in before someone grabbed me by the neck and said, "Let me teach you something, young man." So this isn't just stuff that people can just learn by being around whatever.
You're
You
right,
have to
totally.
you got to take an active role.
You do.
So how do we do it? Like,
So I
how
think
do we do it?
how do we do? I think the thing is, I think social media is a good start. I think also reaching into colleges, medical schools, and I love the direct patient care movement, but I also
Yes.
we need to have medical schools that are built just for primary care. We need to put them in the areas of the state that you want the people to stay. If you set up a primary care practice in a rural area, why not make that tax exempt instead of the
Yeah,
hot?
why not?
You know,
Why wouldn't you?
incentivize people. If you wrote the right incentives, you would have no problem with rural care. So I think there's a lot of solutions. But I think you're 100% right. I think we've got to get through to the employers. I think they're hitting the breaking point. A family plan next year is going to be about $30,000.
Insane.
Insane.
Absolutely nuts.
100%. And how much of that is actually spent on healthcare? Out of that 30,000 is a fraction. It's
It's
insane.
so small. It's just such
So
a small
small.
number.
And the thing is, we've got to get people out. And I think kind of crazy sometimes on X. I'm like, nobody's listening. They're like, people can't shop for it. I'm like, okay, let me ask you this. People can't shop for healthcare, but yeah, cosmetic surgery over the last 20 years has gone up less than the CPI. Why? Because it's cash pay. People shop for that. Breast implants, they shop for that. LASIK surgery. LASIK surgery has been a slow, flatlined down. And if you adjust it for inflation, it's gone down quite a bit because people shop. People are excellent shoppers and just give them the power to shop. Give them control of their money. It's their money. The other thing is we have to get people to understand instead of saying the employer is paying for my health care, the government's paying for my health care. You're paying for your health care. Wisen up. It's your money. Take control of it.
It's
And
your
I
money and it's your children's money.
Yes, 100%.
I don't hear that. I don't think I hear that enough. Now that I have kids, and then, my parents have grandchildren and they go, "Look, it goes really fast." And everybody says that to me. "Man, pay attention to these young ones. It goes really fast." And I go, "Is it my responsibility as a father to take care of my children and to make sure that they have a country that they're not paying for, that I did something better? I'm leaving it better than I started with." W
100%.
Yeah, so social media is right. Join the PHA, I heard you say. Good job.
Absolutely.
Nice. Your check is coming in the mail.
I like that.
And what are some thoughts that you would leave docs with? I mean, we generally have 30 minutes for this. So, what do you want to leave people with? Like, what are some actionable steps that you say, "Hey docs, here's what I think we could do. Let's unite." Like, how do we get the docs to come together?
I would say to them, first of all, you don't have to accept the current situation. You don't have to be
Amen.
employed. That's the first thing. Everybody gets out. They're like, well, I just have to work for the hospital. I have to take grief from this mid-level administrator. I have to. No, you don't have to do any of that. You have to do is put the best needs of your patient first, second, and third. That's it. That's what you have to always do. And I would just say we need to go back. Like I said, when I was coming up, that's what was preached to you. Everybody thinks about it. Now, when I was at the PHA Leadership Summit, I love when the docs talk because when the docs talk, they always talk about patients, outcomes, the surgeries, how you make it better, the cool stuff they're doing. No one really talks about finance. Yeah, you have to make enough money to keep the lights on and all. It's fine, but that doesn't get them juiced up. I don't care who they are. I don't care if
Mhm.
it's Fred Liss, you know, Dr. Cardenas, Dr. DeMaio. They're all the same. They're excited about patient care. That's what gets them juiced. So we have to get the docs juiced about that again. And we have to say, you know what? When I was coming up, docs were rebellious. We didn't listen when people told us stupid things. We pushed back. And the
Yeah.
government's always going to come up. I remember when they said that pain was the fifth vital sign. We need to make sure that our patients are
Mm.
properly medicated. They were telling us to overprescribe opioids. Now, conveniently, they forgot that. They pushed us to do that.
Yes,
And I
they
was
did.
like, I'm not doing that. That's stupid. So I get these calls that are like, the nurse said this patient's pain is a 10 out of 10. I'm like, all right, well, let me go see her. I'd go there. This is how long ago it was. The lady be reading the paper. And I talked to her, and they just didn't understand what the system meant. They weren't writhing in pain. They didn't know. But it's so easy just to write a prescription. Here it is here. But they made it easy, you know. So you always have to say what's best for the patient. And I think we have to lessen the cost of the training for physicians and the time. It takes
Mm.
too long to train people, and we have the wrong people in charge. We have the American Association of Medical Colleges. They're not incentivized to do that. We need people to come in and say, okay, we need to change the whole system. We need more docs. I watched you and Scott Becker talk about that. And you have to incentivize. You know, right now there's 30,000 US graduates of colleges who don't get into medical schools here. And a lot of them are great students. Why are we turning them away? That's stupid. So we bring in a bunch of people, international, and there's some great international docs. I'm not knocking them, but we should fill our residencies with homegrown folks. We got lots of talent here.
Why? But like, why is that so wrong? I'm like, I don't. I'm an immigrant to this country. I took the test.
Right.
But why is it wrong to say, like, hey, it's okay to take a kid from Duke that graduated and wants to go to medical school? Like, it's okay for them. Like, why do we have to have somebody from Tanzania?
Right.
There's nothing wrong with Tanzania, but
Come
like,
on.
shouldn't we take the people from where we are? Yeah.
And the thing is, when you do that, and nobody wants to talk about this, but it's honest. If you take somebody from rural North Carolina, say you get a medical student from there, but they grew up there, they know the people, they know the area, guess what? They're probably going to stay there. That's how people are.
I'm glad you said that because I mean, I don't know how many practices I've been to now this year, maybe 250, 300, something like that. I'm in all of these South Dakota, Nebraska, North Dakota this year for the first time. These kind of like, on the coast, they call them flyover states. And I'm in Kansas, Iowa, Missouri, Oklahoma, Arkansas, Louisiana. And I got to tell you, because I asked the docs, I go, what are you doing here? And probably I might be a little condescending in it and they go, oh, I was born and raised down the street. I was born 30 minutes from here. I was with a doc in Kansas last week. He's from Western Kansas, and now he practices in a small town of 48,000 people. And guess what? He loves it. They
Yep.
need him. And why is
Absolutely.
he there? Because that's where he and his wife are from.
Yep. No,
And he
100%.
he,
Yep.
he didn't want to go home. He wanted to go home.
Yep. No, I mean, that's what's missing. And I practiced for a year and a half in Fargo, North Dakota. And the funny thing is, those are actually the best docs I ever worked with.
Ever.
Ever, because nobody would leave there. So you had to take care of whatever came through the door. It's not like you're in a big city. You know, if I'm in Chicago, there's a zillion subspecialists I can send them to. All right. In Fargo, there isn't. And I took my oral boards, and my case list came from Fargo, North Dakota. And I was there with the GYN oncologist. He was going to fail me because he said, you should have sent all these people to an oncologist. I said, I agree. And he looked at me, he goes, what do you mean you agree? I said, I agree. But there wasn't one in the state. And he goes, what state were you in? North Dakota. And I could see him thinking, like, he's going to tell me who's there. And he's like, oh, there isn't one. I said, no, they wouldn't leave. You know, so these are the best surgeons I ever
I love
operated.
it.
You know, I mean,
I
phenomenal
love it.
guys. So people look down on these like family docs in a little town. Well, guess what? They have to do a lot with almost nothing. These are smart
Nothing.
people, good people. They love their communities. And that's what we need to build up. And the most efficient thing, the other thing I'd say is, I love when people say value-based care. We're going to get a very complicated system. We're going to spend, $1 zillion on software. We're going to, Oak Street Health, and we're going to do all these things. There's nothing more efficient than a 3-person family practice in a little town. There's nothing to it. There's no overhead. They make very little, but it's such low margin, and they do such good work. So I think that's what people look down on. So that would be the things I would say to the docs. The other thing I think is there is a real opportunities in these next few years for physicians to turn things around. The direct patient care movement is really empowering the primary care physicians who were decimated by Obamacare. But now all of a sudden, they've got their place. And they're saying, this is great. Like Atlas MD, man,
Oh,
phenomenal guy. So these guys are getting empowered, and I'm so happy for them. But I want to see it in other specialties. Like you do have Dr. Held in Texas is an ophthalmologist. She's doing direct patient care. We need more specialists doing it. not just, the primary care
Mhm.
folks, but that's a powerful movement because it's really focused on the patient. And the thing is, the government's not going to save us. I wouldn't count on it. I think the lobbying's great, but I think we have to do is show excellence through direct patient care. We have to get the employers on our side. We have to get the public on our side. And the public loves docs. So I read all this stuff. People hate docs after COVID, all this stuff. That's a bunch of BS. I was practicing during COVID. I talked to patients all the time. And the reason why they liked me and they liked all the other docs, we're honest with them. I'd say, listen, there is no science to follow. This is new stuff. This just happened yesterday, essentially. And what all I know is what I can hear from the CDC and whatever's out there is very little information. But every time you come in, I'm going to monitor it. I'm going to tell you every day what's new. And I'm going to tell you what
Mhm.
I don't know. And I'm not going to tell you, because I was talking to pregnant patients, I'm not going to say, you have to get the vaccine or don't get it. I'm like, here's what we know. It's your choice. I'm going to take care of you regardless. It doesn't matter to me. It's your choice. Treat people with respect. Be honest with patients. Patients they'll know instantly if you're a good guy or a bad guy. Dogs, patients, little children, they know it. They know.
I love it.
They're like,
I love
you're
it.
good or you're bad. You can't BS a patient.
Yeah.
They love it. And if they're good, you win them over. They're so loyal. Like I had a bunch of patients. I was in a small town, medium-sized town in Wisconsin, and there was a bunch of people that were from Brazil. But I didn't realize I did a delivery for somebody from Brazil. I turn around, the room is filled with probably 30 patients I'm seeing. They're all from Brazil. And then what happens is you win one person over and you treat them well, and you ask them about Brazil and you talk to them a little bit. Boom, everybody's there from that area. That's how
Love
it
it.
works.
That's how it works.
That's it, man. That's just like guerrilla marketing. Just be nice to people and treat them well. Ask them about this stuff. One thing I did was my last job here in Florida, there's a number of people from Russia that would come in, Russian speaking women, they'd come in, with their children. So I would Google a phrase in Russian, just like, how are you today or whatever. And I listened to the Google, how you're supposed to say it, and I'd say it. Well, of course, I'm butchering it. The kids are laughing. They think it's hysterical.
Hysterical. Yeah.
But the moms love it because they're like, hey, this guy's like
He's
being
trying.
nice. He's
Yeah, he's
trying.
trying.
He's trying.
He's
You right?
thoughtful.
He's
Yeah.
tough. Right. I mean, it's just little touches. That's what people love. So I would say to docs, listen to people, put the computer aside, look them in the eye, examine them, ask them something unique about them so you know something about them. Always learn something. And people love that. And I love that because it makes the job fun. It's
Fun.
interesting. Yeah. So that's what I would say. But I think we've got a great opportunity. I think we could turn it around. I think there's great people like you. Heath Voigtleman is phenomenal.
Love him. Love
Yeah,
him.
great guys. And the other thing, which you said on X, the docs can't do this alone. We can't get arrogant. We need people like you, like Heath, that know the stuff we don't know. We
Yeah.
have to work with you.
We have to come together at some level. Listen, thank you. You made my day. I enjoyed this. Happy Veterans Day tomorrow.
Thank
Thank you
you.
for
Thank
all
you.
you do.
Thank
Let's
you.
catch up again soon.